We would like to see substance users treated the same as any other parent, that you're given a fair shake.
Some advocates say BC's child and family services system is tearing families apart because of the stigma tied to mothers and birthing parents who use drugs, especially those who are Indigenous. They're working towards providing a peer advocate for every substance-using parent.
Parents Advocating Collectively for Kin, or PAC, says if children are neglected or harmed, intervention or support is necessary. But this isn't what they're seeing.
If all you know about a mother or a birthing parent is that they might be a substance user, that's not a reason to take a child or even target them.
Hawkfeather Peterson says there's a false image of the picture-perfect family, which should include families like theirs.
Absolutely, you can parent and be a drug user. And we're just like anyone, we're just like any person trying to do what we can to take the best care of our children. And I really just think the standards for weighing our successes and our failures should be the same as any other parent.
PAC's goal is to hire and train peer advocates across BC. It's developing training modules covering trauma and healing and what parents' rights are. Peer workers already have experience advocating for parents when the Ministry of Children and Family Development visits.
I said to her, I'll be there. I want to be there when the ministry's there.
Heather Spence says her own daughter contacted a public health nurse for help, simply saying she was stressed and losing sleep, like many new parents. She says that nurse called ministry staff for a visit to her home.
Reassures the person that's going through the experience. For my daughter, it did, because I said to her, no one's going to take the baby. I'm going to be there. I'm going to ask questions, and I'm going to be there to support you, and I'll question them.
We would eventually like everyone to do our training modules to understand substance use, because the social workers that work at the MCFD don't necessarily know anything about substance use. And we've experienced that personally, where they don't even know how to read the urine drug screen reports.
Canada's child welfare system has long been criticized as an extension of the residential school system. The Truth and Reconciliation Commission of Canada has called for child welfare reforms to reduce the number of Indigenous children in care. The province recently launched an engagement process to reform its child and family services legislation. It says staff use culturally safe and trauma-informed practices to keep families together. And almost 90% of Indigenous children found in need of protection are able to live safely with their families. Peer advocates say parents are also at an increased risk of deadly overdoses after a child has been taken away. And witnessing the apprehensions doesn't get any easier.
When I see these people lose their kids, it looks like comparable grief to me to losing my son.
In Vancouver, Crystal Laderas, City News.